Welcome to On the Beat, everyone. I'm over here with Dr. Barlow from Regenerative Medicine of Mississippi, and we're talking all about stem cell. You've seen him on our show many times. You know he's one of our leading experts in this actual category. Welcome back to the show, my friend.
Troy, thank you very much for having me.
I love you coming on here. I love the conversation we have. I preach your name to every market I go to now when it comes to stem cell. Explain to everyone very quickly at home, what is stem cell?
Well, stem cells, from a layperson, if somebody would have grabbed me in the elevator and say, hey, what are stem cells? I would say stem cells, we actually have them in every tissue in our body. And those stem cells are there to help your body regenerate and heal itself from damage or injury.
What's the difference in using your own stem cell versus allograft tissue containing stem cells?
Okay. That's a really good question. Now,
they must know something about what you do.
They do know something about regenerative medicine. Now, you can use your own types of stem cells. So one of those types is where you actually can do a bone marrow aspiration from the iliac crest. Now, that would be recommended for someone who is 30 years or younger.
Okay.
The reason is when we age, our stem cells age with us. Right. So there would be no point in somebody being 60, 70, 80, or 90 years old drawing their own stem cells out when we can actually use what are called allograft tissue, which is brand new stem cells that come from an umbilical cord.
Okay. I got you now, because I was like, where are we getting the tissue from? And then but I like what you just finished that off with. But you just said our stem cells age as we age.
Absolutely.
I didn't realize that was possible, because now you're sort of walking me backwards, the stem cell from our umbilical cords. But if we don't have an umbilical cord anymore, we still have stem cells in our body?
Yes, how old are you?
Why does everyone ask me that on this show? I'm 105.
Oh, your stem cells are 105. I'm 55, so see, my stem cells are 55 years old.
Okay.
So why would I want to use my own stem cells from my own iliac crest when I can use what are called day zero stem cells, brand spanking new, right from the umbilical cord?
All right.
But that's the power of this allograft tissue.
I just love it. I love the conversation. Dr. Barlow, explain to everyone, and I know this is a very medical conversation and sometimes can be a little bit hard to grasp. How does it actually work?
Okay. Now that will take a little bit of an explanation. But for example,
can we dumb it down?
Oh, we will. So like, for example, if you were to fall out of the chair, the first thing I'd do is grab you and go, hey, are you okay? And then if you didn't respond, I would say, hey, someone call 911. So what happens, let's say that you have a bad knee and you hurt your knee, okay? Once you have that inflammation and that pain, there's a signal that goes out. It's a 911 signal that your own body does. It's called a paracrine signal.
Yes.
So it says, hey, 911, get the emergency team here, and it draws your own stem cells into this area. Right. And once your stem cells go into that area, it wraps around the blood supply, and then it releases growth factors. And then basically what it does, it allows your body to heal itself. But with me being 55, there's only so much healing that can go on with the 55-year-old stem cell. So we take this allograft, this brand new, this day zero stem cell, and we inject that into your knee, and now we've got all of the energy and all the power of that day one stem cell going into your knee to do the healing.
Where are you getting that day one stem cell from?
It's actually day one, or some people will call it a day zero, because
we'll call it both.
Okay. As soon as the baby is born, okay, then you have the umbilical cord. So you take the umbilical cord. The mom's she's tested, make sure that she's healthy. The baby has been tested to make sure they're healthy. And if both of theirs, the screening has been proven to be healthy, then we can take this umbilical cord, then we can turn that into the American Association Tissue Bank. We get that and we inject it into the damaged tissue.
If you want to find out more about Dr. Barlow, there it all is up on the screen, everyone. Regenerative Medicine of Mississippi. Give them a call. They're going to help you back on the right path. Back after this short break.